The COVID-19 infection surge is truly well and clearly here, even as Maharashtra continues to be the epicenter of the second wave of COVID-19 infections. Financial capital city Mumbai, Maximum City Mumbai, is facing its own battles as daily new cases continue to be around the 10K mark. To speak to us on some of the issues the city is facing and how it's preparing, I'm joined now by BMC Commissioner Mr. Iqbal Singh Chahal. Mr. Chahal, thank you so much for speaking with us on ET now. I want to get straight to the biggest question which is coming up on people's minds in Mumbai right now. Is there a shortage of beds, and why are there so many stories of COVID-19 patients who need beds not being able to get beds on time?
Good afternoon, Tamanna. First of all, thank you for giving me this opportunity to present our Mumbai present status of COVID. Let me make a very opening remark that this figure of 10,000 positive per day shouldn't create any panic. From 10th of February until today morning, we have got 1.69 lakh positive cases in this last 56 days. But if you see, out of this 1.59 lakhs, 1.33 lakh cases have been asymptomatic. That these people didn't need any medicine, they had no symptom, they didn't need to go to hospital. So in the last 55 days, there were only 26,000 symptomatic. And out of this 26,000 symptomatic, right now we have roughly 14,000 beds occupied, and we have 4,000 beds still lying empty with us, with ICU beds and ventilators beds also empty. Now, for example, today morning we got 10,100 positive cases, out of which 87%, that is 8,750 cases were asymptomatic. Now, if you say that Mumbai got only 1,300 cases today, that would be also won't be a unrealistic picture, because the 8,700 people who were detected today morning, they have zero symptom, and they are not even asking for a bed. They are not even asking for some medication. They have to just home isolated. Now, remaining 1,300, they were 50% of them, because symptoms are mild this time. The death rate is just 0.2% against 6 to 7% last time at the peak level. Now, only 50% of them, they seek a hospital bed of their own, which means that we would roughly need 650 beds today, and equal number of beds are getting vacated because the 14-day cycle has set in now, and our 4,000 beds on the dashboard, on the live dashboard on my cell phone, they remain empty like that only. So the discharge and the admissions have started batching, and absolutely there is no crisis of bed in Mumbai. We have 4,000 plus beds surplus, and if you tell the city and the country that Mumbai had only 1,350 symptomatic cases who needs treatment, rather than saying 10,000 people came positive today, you know, the two stories are very different. So we should not create panic, we should not create a scare, and people must know the real facts. And now coming to half a dozen tweets which we see every day of beds not available in Mumbai. Now Mumbai is the unique in the country that we have debarred all our hospitals, 116 of them on the dashboard now, to directly allot bed to anybody. All beds are, all the positive cases, this says today morning, this 10,100 list came last midnight, 12 o'clock to us. And now, since morning 8 o'clock, we are making phone calls to this 10,100 people and this 1,350 people who are symptomatic. We would be visiting them home to home and offering them bed at their residence. And then the same ambulances which go from a war room, they drop these patients on the hospital beds. And by 4 p.m., this entire list gets disposed of. But unfortunately, 95% of the cases are not coming from slums. They are coming from middle and upper class. Many of the people, they tend to influence the labs and hospitals and directly procure a positive report. Now, once the positive report comes in the hand, and if they really need a bed, the hospitals don't give them beds. And they don't have, they are not, the name is not there on the war room list. So they become fish out of water. And in this category of people, very few of them, who every day they make noise on social media that beds are not available. So I would make a very humble appeal with folded hands to every eminent citizen of Mumbai. Don't break our systems. If you follow the queue, there are plenty of thousands of beds lying empty for you.
But Mr. Chahal, as much as I appreciate, and we all appreciate all the hard work that BMC is doing, I think we would not be doing our job if we didn't ask these tough questions, which include that is BMC taking control of the entire system of allocation of beds really working? Because this is not simply people who want to jump the queue. There are serious cases where, overnight perhaps hospitalization is required. Maybe the phone call from BMC has not come in time. Maybe the ICU bed closest to the house is not available. Do you really have the manpower and the bandwidth to centralize this entire
this system was not created yesterday.
Will not precious time and lives be lost?
This system was created on 8th of June last year, not yesterday, day before. And since last 8th of June 2020, we have handled more than 4 lakh people on the system. And I will take personal accountability if even single person of this 10,100 today doesn't get a phone call. And I can be held personally responsible for even a single miss. We have such accurate system. There are 720 doctors, 24 wards, each having 10 online dashboards, 240 doctors in one shift, 720 doctors in 3 shifts. And another pool of 200 doctors in reserves. They are handling these patients. And supposing we have 10,000 lists with 240 dashboards, each doctor needs to just ring up 30 patients and the 10,000 list vanishes. This is the kind of system we have. But today, if I procure a lab report directly from the lab that I'm positive, if I go to any hospital, I won't get a bed. And this is one problem. Second problem is that it is a fact that with the 10,000 people coming every day on the list, with thousands of people who are symptomatic, there is a chance that these private hospitals like Beach Candy, Bombay Hospital, Leelavati, they are the first choices of these people because 95% cases are non-slum cases. Now, if everybody wants to go to Beach Candy or everybody wants to go to Bombay Hospital, obviously they want to get a bed. But I would tell people that our treatment protocols are so well established now, whether you go to BKC Jumbo or you go to Nesco or you go to Breach Candy, the treatment protocol is same. In fact, in our BMC hospital, it is totally free of cost. So why do you wait to get into a private hospital only when the treatment protocol is so well established? If people decide that they are ready to go to any hospital, then there's no problem at all.
Okay. We've spoken about the shortage of beds. You're saying there's no shortage of beds. Will this situation become more grave if the numbers continue to rise, including ICU and ventilator beds?
Tamanna, you'll be happy to know that in the next 5 days, today's Wednesday, by Monday, we are adding 4,000 more beds on the dashboard live, which means every bed is operational with ward boy to a specialist available for that bed. And we are adding 600 ICU more. Today, I have 130 ICU vacant right now. And the total number of discharges today and the admissions almost match. So they'll remain vacant only. And plus, I am putting 600 more ICU and 4,000 more beds on dashboard. Today, the dashboard is 17,400 beds. And by Monday, we'll have 21,000 beds on the dashboard. We'll be almost 7,000 to 8,000 beds empty every day, even if the present 11,000, 10,000 cases continue. In fact, we are prepared that even if we start getting 15,000 cases every day, we'll be ahead of the demand. The supply will be ahead of the demand.
Okay, we've spoken about the shortage of beds. Let me ask you about the rest of the medical infrastructure. There's a very important medication called remdesivir, which is required to treat COVID patients. It's the only one of the few known medications. Is there shortage of this medicine? Because we hear of shortages of medication, now we are hearing shortages of vaccination. So what is the clear picture?
Tamanna, last evening at 11 p.m., Honorable CM Sir messaged me regarding this issue of whether there is a shortage of remdesivir or not. Today morning, 9 a.m., I held a meeting with the team, and I must quote you that 36,000 vials of remdesivir are, as of today morning, 9:30, available with BMC. and each and every hospital has a stock of that, and unused stock is 36,000. I cannot comment on the rest of Maharashtra state, what the status is there, but as far as Mumbai is concerned, 36,000 remdesivir is available to us today, and we have floated a tender of 60,000 which is opening today, and another 2 lakh remdesivir tender which is opening day after tomorrow. But I must admit that in the supply chain, we've been talking to the company in Bangalore and Cipla, they have some issues and the supply is short. So in coming days, we may have to grapple with that, but we are so proactive that we are after them. As far as Mumbai is concerned, I want to make it secure from that point of view. And next issue, you talked about vaccination. Vaccination, we are doing
vaccines.
Up to 50.
Vaccines. Are we short of vaccines?
Yeah, I'll come to that. You know, we are doing about 50,000 to 5,000 vaccination per day. 3 days back on Saturday, we did 64,000 in 1 day, and our plan is to go to 1 lakh. So recently, 3 weeks back, when central government COVID monitoring team had come to Mumbai, and in the final meeting with Honorable CM, I had submitted 3 points to Government of India's COVID monitoring team. Number one, that we intend to do 1 lakh per day. So we should be assured of 1 lakh per day vaccine stock, and then we can go whole hog and vaccinate our 4 million people in Mumbai. We already done 1.4 million, 2.6 are still left, 45 and above everybody. And second request was, if we could convert this vaccination drive into mass campaign of door-to-door campaign, and we can go home to home, door to door, the way in our, we started this campaign of My Family, My Responsibility from 15th September to 15th November last year. And Mumbai has 35.1 lakh families, 3.5 million. And we visited each home twice through our strong 100,000 BMC employees. And we are sure that again, third time, we can go home to home and vaccinate people if we are giving abundant stock and if this permission is given to us. So tomorrow again, the central government team is coming here. So we'll again raise this issue, and I'm sure things will be sorted out.
Okay, I want to speak to you a bit about the restrictions that have been put into place, and the fresh round of guidelines talk about further restrictions for housing societies. There are reports now that police officers will be stationed outside housing societies to ensure there's no violation. Do we really need that kind of tight restriction, Mr. Chahal, where we are not trusting Mumbaikars to go by the rules and abide by the rules?
Tamanna, last time when the Government of India COVID team came, they had pointed out that our micro-containment zones. Now, what is micro-containment zone? We don't have now many containment zones in slums because, as I mentioned, that 95% cases are coming from non-slums. In fact, last 10th of February till today, the last 56 days, in the slum, the containment zones have gone down from 160 to just 70 only now. They're falling. Despite all this, the number of containment zone fell down, whereas the number of sealed buildings increased tremendously. So the Government of India had advised us that we must have very tight plan for micro-containment zone. Now, what is a micro-containment zone? Basically, a sealed building where you have certain number of more cases. So, keeping in line with the advice given by Government of India, we decided that all those buildings which are more than 5 cases each, every building in our society, that should be called a sealed building or a containment zone, micro-containment zone, and we will ensure that this virus doesn't spread and come out of that building, because more than 5 means it may have 20, 30 cases also in one building. So we say that the primary responsibility lies on the office bearers of the cooperative society, the secretary and the chairman, that those flats where home isolated people are there, symptomatic positive, they should remain sealed in those flats. They shouldn't come out into the premises of the building and spread the virus in the rest of the building. Now, next, these if they fail, then we cannot be mute spectators. Then we have decided that we will have our own machinery there, including a policeman posted to ensure that there's no ingress or egress from the building and nobody enters or leaves the building unless the virus becomes zero in that building. And this is also a warning sign to other buildings who are being lax, who have been careless, and the virus is spreading. And if they have 2 or 3 cases today, they should pull up the socks that because the moment they become 5, they're going to make those buildings also micro containment, because it's the only way to break the virus chain. Today our positivity has gone to 22% from 3%. We cannot just keep quiet. We have to break this chain.
Yeah. So, Mr. Chahal, what is your assessment internally with all of these strict restrictions in place till the 30th of April? How soon do you think that we will start seeing the number of infections coming down?
Tamanna, the experts tell us that for the last 10 days, Mumbai has stabilized to 10,000 cases a day. But I must tell again and again, this is like 1,500 cases a day. And one more important thing, till this wave started on 10th of February, we were doing only 16 to 17,000 or sometimes 15,000 testing every day. Deliberately, without any fear or worry, because we have so much health infrastructure, we made testing 50,000 a day. Today morning, we did 53,000 testing a day yesterday, which report came today morning. Now, if you take these figures back to 15,000 from 53,000, these 10,000 cases will become 3,000 cases. But we don't want to shy away. We want to flush out this virus as early as possible by giving a major push to testing. And this is another reason why more 10,000 cases are coming, because testing has gone from 15,000 to 10,000, from 1,500 to 10,000. And this is and out of this 10,000 also, you hardly have 1,500 people who are really, you are worried, you will take care of them. And if you see in the last 55 days, since the second wave started, we got 1.59 lakh new cases, and the number of deaths are only 428.
Yes, you mentioned this, sir. Yes.
Yeah.
If I just may ask you that forward looking, what is your assessment? Can we see the situation stabilize and reduce number of daily cases in the next 2 to 3 weeks?
Yeah. So experts say that we are stabilizing. So maybe possibly by the last week of April, the downslide can start.
Okay. Let's hope for that. Let's hope for that. Thank you so much, Mr. Chahal, for speaking with us and answering all of our questions.
Thank you very much for giving the opportunity. All the best.